Today's topic on Keith RN, do you have what it takes to be a nurse? As we look at nursing today, it is going to be one of the highest growth professions and occupations in the next 10 years, with over 1 million nurses needed between now and 2022. So this is an opportunity for many to enter this honorable and highly respected profession and make a difference in the lives of patients, of those that you will care for. But just as the Marines are looking for a few good men, the nursing profession is also looking for a few good men and women, not just warm bodies, to fill a vacant position. So we want to know if you have what it takes to be a nurse. I'm going to ask 10 reflective questions that I want you to honestly reflect as I go through them briefly with some brief reflections, and ask yourself, does this fit me? Yes or no? Or is this a weakness or a strength that I need to make a strength by the time that I graduate from nursing education? So let's look at question number 1. What is your passion in life? In other words, what would you be willing to do for free because you enjoy doing it so much? Now, for myself, I was reading a book about 10 years ago by Christian author John Eldredge called Wild at Heart, when he had this quote. He says, "Don't ask yourself what the world needs, but ask yourself what makes you come alive, and do that. Because what the world needs is men and women who have come fully alive." And I believe that each of us have God-given passions and talents that are a part of who we are. And when we are doing that, it makes us come alive. Now for myself, about 10 years ago, I was at a crossroads. Do I pursue nursing anesthesia and make 6 figures? Or I realized how much I love to teach and mentor new nurses and go and get my master's in nursing education. Well, truth be told, I chose my passion, and I'm so thankful I did, and have not looked back since. And that is why I'm doing even this video today as a nurse educator. And so the bottom line is, I want each of you to reflect and say, does caring for others make you come alive? Does caring and all that's required as what you have understanding of the professional nurse, is it something that is kind of in you and that you would enjoy doing it because you have that ability and that desire to care for others? Second question, why do you want to be a nurse? I want you to dig down deep and look within. Many of you know what the right answer is. Oh, you'll say, because I want to care for others. But is that really true for you? What really gets you excited about nursing? Is it caring for others and making a difference in the families and the patients of those you care for? Or is it the opportunity to make pretty good money for what you do, with benefits and all that goes with it? If this is your primary motivation to become a nurse, I want you to really carefully reconsider and examine your choice, because studies have shown that when a nurse is not highly engaged and attentive to patient care, because they may be distracted not by so much the caring, but by just going through the motions and doing a job, patient outcomes can be impacted. So the bottom line is, dig deep and determine what it is that motivates you to be a nurse. Number 3, do you easily identify with the feelings of others? In other words, this is referring to empathetic caring. How you honestly answer this question is extremely important to determine your aptitude to become a professional nurse. Remember the old Gatorade commercials with Michael Jordan sweating Gatorade? And the Gatorade question was, is it in you? My question to you is simply this: is caring and compassion and serving others in you as well? A religious leader of the Jews asked Jesus over 2,000 years ago, "Who is my neighbor?" And Jesus shared a brief story of a man who was severely beaten and left for dead and on the side of the road. And 2 religious leaders saw the man but ignored his plight. But the Samaritan, despised ethnic group, group at that time in Palestine cared for the man, brought him in, and took care of his wounds. And then Jesus asked a question that's important to every one of us who want to consider caregiving today. Who do you think proved to be a neighbor to the man who fell among the robbers and the one who showed him mercy? And Jesus answered, "You go and do likewise." And what's important to know about the story of the Good Samaritan is that when the Samaritan saw the man in the ditch, unlike the religious leaders, he was moved with compassion, is what the scriptural narrative describes. And so that type of heart of seeing your patient as your neighbor and moving with compassion towards them is the essence of what it means to be a nurse in practice. Fourth question. Do you enjoy and find fulfillment in serving others? Now, nursing, many of you had service position jobs, like you were waiters, waitresses, etc., that depended upon tips. For example, in that context, the customer is the center of everything that you do, and you are intentional in serving your customer to meet their needs. And the essence of nursing is serving others in a time of need. It involves doing whatever is needed to ensure that their needs as well are fully met. Did you enjoy doing that in a service industry? Then you can rest assured that nursing will likely be a very good fit for you. But the ability to serve must also be present regardless of how the patient or the customers may have responded to you. You don't always have nice customers, and you won't always have nice patients. That is why maintaining empathy and putting yourself in their context, in their experience, is so important as a professional nurse. Can you still care and serve that patient even if it appears to be unappreciated? If you remain empathetic and do not take things personally, you too will be an excellent nurse in practice. Fifth question. Is spirituality important to you? And how comfortable are you in discussing this with others? I want you to recognize that the medical model is very focused on the physical needs of the patient. But nursing comes from an entirely different worldview. It came out of the Christian worldview of looking at the emotional, the spiritual, and the physical needs of the patient and of the person, looking at the holistic needs and care. And therefore, in order to be a nurse in practice, you must also be able and willing to provide spiritual care, not just physical care. Now, what is spiritual care? I'm not going to go into it too deeply, but it's not praying with your patients, though it can be. But it is serving them with that heart of compassion is the essence of spiritual care. But it's also recognizing that some patients are in a crisis. They have just been diagnosed with cancer or a terminal illness, and they are facing death, or maybe they are dying. In those contexts, you can rest assured that the spirit and spiritual care are going to be on the mind of your patient. Are you able and willing to go there in that context? And I can tell you from my own experience that you can't give to others what you don't have within. If your spirit and if the spiritual aspect of your dimension of humanity is not being nurtured, if you don't incorporate that in your own personal life, you cannot give it in a way that will be meaningful to others. So I want to encourage you, if that's kind of you, maybe whatever your faith tradition may be, nurture it, encourage it, because you will be required in practice to care for the spirit as well as the soul and the emotional needs, as well as the obvious physical needs. Question number 6. What kind of character do you possess? And I'm not talking about being a character. I'm talking about character. For example, truthfulness, honesty, obedience, humility, sympathy, and being punctual. Every one of those aspects are relevant to the professional nurse. In fact, did you know that for the last 13 years, according to the Gallup poll, nurses remain #1 as the profession that has the highest regard of ethical and moral trust. We are even a lot greater than physicians and pharmacists. we as professional nurses, if you're a student, you need to have a degree of inward character that holds yourself to the highest level of moral and ethical behavior because your patients require it and the profession demands it. Next question. Do you possess a strong work ethic? Now, nursing is hard work, and nursing education is even harder at times. So recognizing this, that when you are in practice, patient acuity, especially in acute care, is high. 12-hour shifts are the norm. Weekends, every other weekend, off shifts are the norm. And you'll have multiple patients, not just 1 or 2 as in nursing school, but typically 3 to 5 on the floors in acute care, and 5 to 10 plus in transitional care, and much more in a long-term care or skilled care setting. So your desire and ability to work hard and to be a hard worker is going to be central to your ability to successfully transition to professional practice. Next question. What are you willing to give up to make nursing school a priority? This is probably one of the most important questions because every one of us has 168 hours in a week. And nursing is a difficult and challenging major that requires at least 20 hours of study a week. Now you do the math between sleep, attending school, attending clinicals, between the study time that's required to work 40 hours a week is unrealistic for most students. Now, I understand if you're a breadwinner and you must work full-time, it is going to be a hard road to hoe. But if you are unable, or if you are able to slice that work week down to 20 to 24 hours maximum, your chance of being successful in nursing education, and more importantly, retaining the information so you can use it and apply it in the practice setting, is imperative. Need to re-examine and reassess your social use of media. How much time do you spend on Facebook, Twittering, and all that goes with YouTube? Even though you're watching YouTube, this is one I want you to pay attention to. But the bottom line is this. How many hours a week do you spend doing that? How about friends, going out? You're gonna have to make some sacrifices, but it's worth it to make a short-term sacrifice for a long-term gain. Your learning as a nurse is worth that. Next question. Do you have a natural aptitude for the sciences? Now, the sciences of nursing is a science. And we have the applied sciences of pharmacology, pathophysiology, and fluids and electrolytes, all very difficult sciences. Assess yourself. Is this a weakness or a strength for me? If it's a weakness, you're gonna have to put in additional study time to make it a strength. So therefore, recognize your limitations if this is one of them, but recognize that you'll need that time and commit yourself because the nursing is immersed in the sciences. Give yourself that extra time so that you are successful as a nurse as well as a nurse in practice. Next question. How well do you perform under stress? How many of you, if you're already in nursing school, you already know that nursing school is very stressful, as well as the clinical setting when you're taking care of patients is very stressful. But what about this? Many of you, for example, have done your CPR certification and you have already passed your basic life support. You have your card. That's one thing. What about if you enter into your patient's room and they're not breathing and they're ghostly ashen pale and there's no pulse, and now you have to initiate CPR, call a code, and begin life-saving interventions? That's extremely stressful. Recognize this. How would you handle that? Now, because of your inexperience, it would of course be stressful, but would you function in a way that would promote the best outcome for that patient, or will you blank out and totally panic? I want you to recognize the importance of essentially realizing that nursing is at times extremely stressful, and how you function under stress will determine your success as a professional nurse. And our last question, how well do you handle conflict with others? Now, when you look at conflict, how do you personally go after this? Because this is the problem we're addressing, incivility and bullying in the nursing profession. And this is really ground zero. When there is conflict, are you direct or are you indirect with your communication and addressing the problem that you have with another person? So for example, if someone offended you in practice or as a student or a faculty, do you tell everybody else but the person you have the conflict with to get them all on your side? Or do you just simply in private go straight to the person, communicate your concern, deal with it, and move on? That is professional, and that is direct communication. That must be the pattern as a professional nurse. And as a student, hold yourself to the highest standards of professional and direct communication. So for example, many programs, it is completely acceptable and commonplace for students to hear students talking ill will about their faculty, about the program, and even about other students. That is unprofessional, and that is going to contribute to the problem of incivility and bullying that is unfortunately a part of nursing today. I want you to be a part of the needed change and commit right now to hold yourself to the highest levels of professional behavior. That is direct communication, not indirect, as it is currently in academia. So let's go look at our questions. How'd you do? Well, remember I told you to reflect and say, is this a weakness or is this a strength? And if you could honestly state that about 7 to 8 to 10 of these questions were a strength for you, using the same barometer, or the barometer of 75 to 80%, which is passing in most education programs. This is completely unscientific, but just a general gauge. You have what it takes to be a nurse, and you will likely be successful as you are. You may have some fine tuning to do, like we all do, but yet that's a good start. If you had 5 to 7, don't give up. Recognize your weaknesses and make them a strength. And if you're less than 5, recognize that that may be a potential problem that you may want to consider and just look at, do I really have what it takes? I'm not saying you don't, but realize you have work to do. And these are just my observations based on 30 plus years of clinical practice. Now, if you like this video was derived from the second edition that I am just completing of my book for students called Think Like a Nurse, Practical Preparation for Professional Practice. I have an additional 15 questions in Chapter 1 with reflections that will help develop and strengthen to identify your weaknesses so that they can be made a strength. And so I want you to know that there's a link to this video. I want you to consider going to that, seeing more information, and I know that this will be an incredibly helpful resource to help you successfully transition to professional practice. Thank you so much.